Hello everybody and welcome to my channel. This is Dr. Hussain, and in today's short video we'll be discussing about pulse rate. So as a medical professional, we need to know how do we measure or how do we calculate the pulse rate. So pulse rate measurement can be done in two ways. One is from the radial artery, that is the radial pulse, and in order to confirm further, we can also auscultate it through the apical pulse. So remember two ways, radial pulse and apical pulse. So what is the normal range? The normal range is 60 to 100 beats per minute. So this is the normal range, 60 to 100 beats per minute. And if it is less than 60 beats per minute, then it is called as bradycardia. And if it is greater than 100 beats per minute, then it is called as tachycardia. So how do we measure this radial pulse? With the help of the three fingers of your right hand, place it over the radial artery and press it with two fingers and then palpate it for 15 seconds or 30 seconds. If you calculate it for 15 seconds, then multiply by 4, then that gives the pulse rate for 1 minute. If you calculate it for 30 seconds, then multiply by 2, that will be giving you the pulse rate for a minute. And if you find the pulse rate which is irregular, okay, it is not regular, then you can compare it with the apical pulse and you can correlate it so that you can find the difference. So in some cases, there will be a difference between the apical pulse and the radial pulse. So this difference between the pulse rate of a radial pulse and the apical pulse, that is called as the pulse deficit. Okay, it is called as the pulse deficit. Now, how do you measure the apical pulse? So for checking the apical pulse, you need to know the fifth intercostal space along the mid-clavicular line of the left side, fifth intercostal space. With the help of the stethoscope, you need to auscultate it and check for the pulse. So this is the way we measure the pulse, which is radial pulse or the apical pulse. I hope you all like this video, and if you like it, please share, follow and subscribe, and see you in the next video. Thank you.